Life's not the breaths you take, the breathing in and out that gets you through the day ain't what it's all about.
But for millions of Americans suffering from COPD, that is exactly what life is all about. Breathing in and breathing out. Today we are going to talk with Cindy, a respiratory therapist, who is going to tell us about breathing technique which helps COPD sufferers.
I'm certain just about everybody knows someone who's been diagnosed with COPD. But what people don't know is exactly what's meant by that. COPD is a catchphrase for several different lung conditions, and one of these is emphysema. The lungs are made up of little tiny air sacs called alveoli, and these alveoli are clustered together kind of like grapes. And the clusters are connected together with airways called bronchi or bronchioles.
What exactly does it mean to have emphysema?
Emphysema has different causes, but the most common cause is cigarette smoking. The chemicals in the cigarette smoke actually cause destruction to the walls of the alveoli and to the rigid structure of the airways. And when that happens, air becomes trapped in those bloated air sacs back behind the collapsed airways. When air gets trapped like that, the person can't exhale their carbon dioxide. They can't get rid of it. And we as humans breathe primarily to get rid of carbon dioxide. So when you can't get rid of your carbon dioxide, the body signals, hey, wait a minute, there's something wrong here. And that is perceived as a feeling of shortness of breath or dyspnea.
What can a patient do to get rid of shortness of breath?
A breathing technique known as pursed-lip breathing can help an emphysema patient get rid of more of his carbon dioxide, thereby helping to ease that sensation of dyspnea. When a patient uses pursed-lip breathing, they inhale through their nose and exhale through pursed lips. And exhaling through the pursed lips creates a slight back pressure into the lungs, which helps split or hold those airways open. When the airways are held open longer, more of the carbon dioxide can come out. The patient learns to breathe in to a count of 2 through their nose and out to a count of 4. Kind of like smell the rose and blow out the candle. Counting into 2 and out to 4 helps slow down the patient's rate of breathing, and it helps control their breathing cycle. So the airways are held open longer, and they'll get rid of more of the carbon dioxide, thereby being able to breathe in more oxygen. Some patients actually practice this by blowing bubbles or blowing on a pinwheel. It's important to practice this technique so it becomes second nature. This will allow the patient to use pursed-lip breathing without even having to stop and think about it.
Isn't this type of breathing also used as a relaxation technique?
Yes, it is. Due to the regularity of the breathing pattern, it is very relaxing. It's actually the type of breathing that is taught with yoga and meditation.
Thank you for being with us today to explain pursed-lip breathing.
You're welcome. I hope all the emphysema sufferers watching this will learn and benefit from this breathing technique.